Hello, I'm Catherine Holland, and this video is about treating your own knee pain. I did an earlier video which is called Knee Basic Self-Treatment, which shows you the basic massage strokes that you use to warm up the muscles, to make sure the blood is flowing quickly. And this video is about the particular muscles and areas that you want to work on depending on where your pain is. So I'm going to sit on the mat on the floor and I'm going to show you which areas to work on so that you can help your leg and your knee to move well without being so painful. So here we go. I'm going to turn, I'm going to put the camera down a bit. I hope you can see because I'm losing colour. To make sure I've got enough light. Okay, so maybe move that a bit. Maybe I'll chop that out. Okay, so let's imagine that this is the leg that you've got pain in, okay? Starting off, having done all of the warm-up in the previous video, which you can do with your hands, and the emphasis is this way, upwards. We're trying to encourage blood flow, lymphatic flow upwards all the time when we're working on our leg. You can also use your arms, but you can look at the other video for that. So now what we're going to do is look at the knee and see where your pain is. So if you have pain above the kneecap here, or below the kneecap here, directly above or below, then this will be to do with your quadriceps, which lie here and they reach up to the front of your pelvic bone there. Can be quite difficult to get to the attachments here. There are 4 attachments, quadriceps, meaning 4 heads. One is directly on the front. 2 of the others are a little bit further down, and one of them is underneath the other one. So that's much more difficult to get at. You have to work through the muscle you've got. And sometimes it's worth going in from the side so that you can get to the different attachment points. So most important really is the actual bone going across to the hip. And one of the ways you can work on that is by putting your leg up on a table so that it's relaxed, and then you can get in here better. But also, of course, you can sit on the floor, which is what I'm doing. So after you've done the basic massage, then what you're going to do is to particularly work on these attachment points. So the quadriceps are all attached up here. They run 1, 2, 3, 4, and then they're all attached just below the kneecap here. And these are places that you can work, the attachment points as well as the centre of the muscles. So as well as being doing general massage on the whole lot as a bunch, I find it's really worthwhile doing some work on the sides so that you can get to more specifically separating out the different strands and getting the different depth. So if you bend your leg, for example, like this, then you can find your way to different levels of the quadriceps muscle. And you can find any injuries, which I've got one in the middle of here from a car accident a long time ago. So I sometimes work on this when I find my leg is not working as well as I wanted to, not as strong as I wanted to, gets tired quickly. So I work on this pretty much every day. And then these below the knee, you can use both knuckles. You can use one knuckle in the centre. You can use knuckles top like this. And you will find knobbly bits, aching bits, rough patches, all of those. And the idea is that you work on them. This is solidified lymph probably, or injury to the tendon, patella tendon. And if you do this, and then you can bend your knee to work under kneecap a bit more, you may find that's more painful. It's all very accurate stuff. And then the other end, which you have to experiment and explore. If you look on Google, you look up the name of each individual quadricep muscle, Rectus Femoris, lateral, medial, and underneath. I'll list them underneath because they're not at the top of my head right now. Then you can work on those. So find a way to do it. You might have to lean back a bit so you can use your knuckles. Then you can get at the actual point on the edge of your pelvis here. And you can do this way, do this way. You can go to the sides. It's a very big tendon, so you might have to work on just the side of the tendon. And then you can go a little bit lower down because some of the tendons are actually attached to the top of the femur. They go across the knee, they don't go across the hip joint. Some of it goes across the hip joint. If you have a look, you can see them on Google. So what I'm suggesting you do is you do this sort of attrition using your knuckles, and you do it for probably 5 or 10 minutes on each place, and then you do the general work on the centre of the muscle as well. So that's if the pain is above or below the knee. Now, if the pain's at the side of the knee, then you need to work on different muscles. If the pain is at the sides, here or here, then it's a hamstring injury that we're looking at. And to work on your hamstrings, you have to be a little bit inventive. Easy enough to do this part. But if you look at the lie of the muscle, if you go to Google, you'll see that this muscle on the outside goes to the ischial protuberance on the back of the pelvis there, and there are two on this side which also go up to the same place. So the way to work on the centre of the hamstring, if it's your own leg you're working on, I find either, make sure you can see, either working like this, or working like this. You have to find a way that you can do it yourself. This is really satisfactory actually, it's really good, both knuckles down the sides. And then the top of the hamstring is fixed on what's called the sitting bone politely, and you can just lie on your knuckle and work on that. That's relatively easy to do. So I hope that helps for finding hamstring injury. Next area I'm going to show you is the adductors on the inside of the leg. Same level as hamstring, just further out. You'll find the first of the adductors is attached, the longest adductor, and I've usually got a bumpy place there, it's quite easy to tell. And adductors go up the inside of the leg. They're up the inside and they're attached to the pelvis, just next to the quadriceps there. And there are a number of adductors, maybe 9, and they are attached in a line along this inside of the femur. Well, actually 2 lines, but anyway, close together, like an archway. You can find them as you go up, and if you notice painful areas, that's a good place to stop and remove the damaged tissue and get the blood flowing through. And so you can use the strokes to sweep, encourage the blood flow, encourage the return of the lymph, and then you can use the friction to move along some of the hardened lymph, get the blood flowing through where damaged tissue has been stopping it from flowing. And then if you try and find these, the top of these, just looking next to quadriceps, moving along, you'll find them as you go that way, in towards the centre. So that's adductor. Now, the other one to look out for, maybe I'll turn around now, is similar place on the outside of the knee. You'll find, just make sure you can see, this is where the ITB is attached, which starts on the outside corner, the top of the hip bone here, and a little shell-like depression there, and it runs down to the bottom outside corner here. So the way to treat that, apart from running up the length of it, which is really, really comforting and helpful if it's not feeling well, and doing the strokes which we've done before in the other video to get the blood flowing through, separating out the fibres. Obviously the ITB is a very long tendon going from here to here. And the reason that it's tendon here is because we don't particularly want it to stretch, because it's supporting us and stopping us falling over sideways. The top of the muscle is attached in here in this little depression, so you can work on that either by using your fists and knuckles, or you can find a friendly corner of a chair or a banister or something, table, where you can do that. Some people use a squash ball or a tennis ball or something to help them to roll in there. Depending on how flexible you are, you can use pressure, 2 hands together, I find very good, and I find that a very useful place. So those are the two ends of the tensor fasciae lata, ITB, and that's where the muscle part is. It's just a short muscle and a very, very long tendon. So I hope that helps you to find the areas of the knee that you need to work on for yourself, and you're able to get less painful movement. Thanks for watching.